Okay, we're back from our break and on item 10, which was the award for the nursing facility and the hospital. We received notice from Modern that they're rescinding their bid or retracting their bid. And it was received apparently timely. I'll turn it over to Sean since he's the one that received the notice.
Sure. So it's going to be my recommendation to the board that we rescind the resolution awarding the bid and that Seneca rejects all bids and rebids, goes through another rebidding process at a later date. Of course, we're going to, reserve our right, as we rebid this to anticipate change provisions, the contract consistent with applicable law through the project within the budget. So we get within budget. So my recommendation is that we rescind the award and that we reject all bids and that we rebid this project with under all provisions of the law. So that's gonna be my recommendation.
Okay, so do I hear that motion?
A motion to approve.
Okay. Ken?
I'll second.
Okay, we've got a motion. Shelley, Ken second.
Aye.
Shelley votes aye.
I motion to
Ken-
approve. so-
Right, Ken? Jerry? We may not have her back.
Are they back?
I vote yes. So that's 3 of us.
Sorry, are we back in session?
Yes. And I assume you didn't hear any of what was said?
No, I didn't, sorry.
Okay, well, we took an action. We're in the process of voting on an action right now to rescind the resolution that we just passed, resolution 440.
Okay.
To reject all bids and with the idea that we'll go out for rebid at a later date.
Okay.
And so we have yes, we had motion made and seconded, and we have yes votes from everybody, and we're waiting for your vote.
I'll vote yes.
Okay, there you have it. Okay, that moves us on to item 11, which is the Chief Financial Officer's report. Steve, is Steve on?
Yep.
Go for it.
Yeah, I'm on remote, you bet. Okay, what we're looking at here is the financial report, financial statements for the month of January 2024, the 7th month of our fiscal year. Kind of straightforward, consistent with what we've been experiencing the last couple months, going back to November of 23, with a little bit of improvement on the revenue, but the revenue still is significantly below budget. In the case of January, the gross patient revenue was negative to the budgeted amount of $330,000, just over $330,000. Combination of outpatient revenue just under 258 and inpatient revenue just under 73. With the positive variance on deduction, since the revenue was lower, we ended up with a negative variance of net patient revenue to budget of $233,000. Expenses mainly fell in line. Salaries and wages were above budget, but contract labor provided savings. And the overall was a slight negative budget variance for total operating expenses of $31,000. We did receive some tax revenue in January, but it was from fiscal 2023. As you recall, we had some conversation about how the county had been behind in their distribution of tax revenues to Seneca and other taxing entities. And this amount here, normally we would receive a couple months after the end of the fiscal year, and we'd be able to include it in our year-end accruals and our external audit. And we're unable to do that. So we're running it through this year's this year's operation, and that's why there's no budgeted amount against it. As of note, we did receive our first installment. We get 2 installments, half the year, then the other half of the year. First installment's usually paid in January of the fiscal year, I guess is the way to say it. And we did not get paid in January. After some inquiries by Sean, we were finally able to receive that first installment in March. So this month. So we have that money in the bank. So away we go, I guess. We would presume that we won't receive our second installment, which we normally get around June. We probably won't receive that until after the end of our fiscal year. So let's see. So that provided a little bit of a positive variance in there, and it led to a positive variance in non-operating revenue. Led to a total net loss of $529,000 versus a budget amount of $318. Yeah, if you just go down to the bottom of that second page, for a negative variance of $211,000. Again, this is what we've been experiencing. It did make a nice improvement. Unfortunately, February, 2 things. One, February this year it had 29 days. So there's a little less revenue coming out of 29 days than there would be from looking at a 31-day month like January. But when we normalize it to the same number of days or patient revenue per day, we were down in February. I have not been able to take a look at March yet, although we had the full complement of providers in March, a physician, a full-time physician, the 2, a PA, an NP, and then Dr. Ware on a part-time basis, and these walk-in clinics. So March should look better revenue-wise. Okay. Let me, sorry, Brian, why don't you go back to the first page, and I'll just hit a couple of highlights, and then we'll talk about them a little more in other documents. So down at the bottom, days cash on hand decreased in January. We did have 3 paid payrolls in the month, which adds another $350,000 to $70,000 in cash outlay. And our collections have been somewhat low. Although in January, we did start to receive some of the long-term care payments that we had not been able to convert previously since the conversion to Cerner and Americare. Our days cash on hand did go from 53, just over 53 to just over 41. There are 24 days of cash, the way that I present the financials, in the board designated funds. So in reality, our available funds on hand went from 77 to about 65 in the month of January. Accounts receivable is at total all sources. So Cerner, Americare, and what's left in Evident, which is almost entirely self-pay, is at $6.92 million, which was $295,000 increase over December. Like I mentioned, there were some, this was the first month that we saw some good collections or any collections on the long-term care. And this led to our total AR days at 116.77. So that's the financial report as looking at January. I know we're going to talk about cash a little bit. We're going to talk about revenue cycle and accounts receivable. Any questions on what's been presented so far?
Nope.
Okay.
You kind of
So Brian, I sent you a file right before the meeting started. I don't know if you're able to snag that. I'm presuming, yep, Brian. Yep. Okay, so in your packet, there was cash flow projection, the same one that we've been doing previously, and kind of funny presenting the January financial statements, then talking about March. So bear with me. So one of the big things that happened in March is that we had made, or there were a couple pretty big things. We had made a request. I'm looking at that. Brian. Oh, Brian, would you go to 331-24 tab? Thank you. Way to the far right. Hey, there it is. Okay, so a couple things happened here. What we did is we, as you can see, our big influx of the supplemental payments, the rate range and the QIP is scheduled to be received in May. We're still on track for that. But when we made our intergovernmental transfer in February, I reached out to our two managed care plans, California Health and Wellness and Anthem, and I said, hey, we just sent in our intergovernmental transfer for rate range and QIP. Is there any chance you guys could expedite our supplemental payment? I mentioned we're going through a system conversion and the new hospital build and everything, and it would be fabulous if we could receive that money sooner than the normal distribution. They both said, okay, we'll look at it. Then California Health and Wellness came back and said, and they give us the bigger chunk of the rate range. They're like 2-to-1 on Anthem. And so they came back to us and they said, hey, we can send you $1 million right now. And we said that'd be fabulous. So here a little bit ago, a couple weeks ago, they sent us that $1 million that you see in column M there under rate range. Yeah. And this.
Yeah, I want to interrupt here and say thank you, Steve, for doing that very much, because I mean this helps me breathe a lot easier. I'm sure the rest of the board feels the same. And also to Sean for chasing down our county property tax money.
Yeah, that was it was nice. It was nice that that people worked with us and helped us out. They didn't have to do it. So it was nice to see. So at the same time, down at the bottom there, row 22, the 101, the 1,011,011. This is our cost report settlement from June 30, 2023. When we filed the cost report, there was a receivable of about $750,000 as filed. That included a full settlement on the rural health clinic of about $170,000. That one I'm not so sure about. So when we estimated what we were going to receive from the cost report settlement, we lowered that amount down. And in previous cash flows, we had that number there more around $600,000. The other piece of what we get when we do a cost report settlement is they settle the actual fiscal year. So in this case, June 30, 2023. And then what Noridian, our Medicare administrative contractor, what they'll do is they'll apply the rates from that settled cost report. So our per diem inpatient rate and our outpatient cost to charge ratio, they'll apply it to the current fiscal year. So from July 1, 23 forward, and in this case, they went through February for the data they had. And by applying those higher rates from fiscal 23, it led to us receiving another $250,000. We had an idea that we'd be getting this. I had a pretty good idea. I just didn't want to put it into this projection because I didn't have a basis to determine exactly how much that would be, how much Medicare revenue we had in the fiscal year. So long story or short story long is ultimately we received just over $1 million when we previously had projected just under 600,000. So that was a windfall of $400,000. Then the last piece that came in, and this was unexpected, I guess we kind of asked for it, but just this week, California Health and Wellness gave us our full supplemental payment for QIP, which is the $520,797. So a lot of money came in. And Brian, if you go down to, I don't know what it is, probably about, there we go. So when we look at where we stand, and this is a pretty close number. Row 41 is what we're projecting for our ending cash balance on Sunday. There might be some stuff that goes in the bank tomorrow, a little bit on Saturday, some electronic transfers, but otherwise we've posted all of our cash through today that we've received, whether it's through the mail or through electronic transfers. And we're sitting on about just over $3.8 million from all sources. And that equates to about 66 days. So that's a nice big change from when we were looking at 45 days in the last projection. And I don't know, probably there were some cases where we had less because we didn't have these other payments in it. So I think this provides us a level of comfort as we look into one other thing. We'll talk about it a little more in the revenue cycle discussion, but we've had a real windfall of claim payments since we had a discussion with R1 and discussion with the treasurer's meeting about our concerns about where we're at with the progress of the activities we've been undergoing, and our cash receipts for the month of March are going to approximate our expectations, going to be very close to our expectation, and it's going to include long-term care less than we would project. So we're seeing payments on the hospital side finally, which is fabulous. So then as we move into April, a couple of things are going to happen. We finally resolved our interface issue between Cerner, can't remember what it's called, their long-term care module, sending this information over to Americare, our billing system. We were unable to bill for the months of January and February. We have since sent out, as of last Friday, 22nd, we billed all claims with approved TARs. There's only 3 months of care that don't have approved TARs, and I think I saw something come through today. But we billed the entire months of January and February last Friday, and we're now in a position to bill March. March's long-term care days probably by the end of next week, which could possibly lead to us getting paid in the same month. So we're looking at the possibility of 3 months, at least 2 for sure, unless something weird happens. And then that third month, March, in the month of April. So we're expecting that windfall. And then as we're starting to see more hospital payments, we're starting to see some other things on the revenue cycle. I think that this projection going forward is going to be attainable and fairly realistic. And of course, the discussion from the earlier meeting is going to change maybe some of the timing of these expenditures on the project and when we get our interim funding. But regardless, you can see even after that column O, after we meet our $8 million obligation for our equity contribution and make some payments on the project, that we're projecting that we'll be at 84 days of cash on hand. So we still have to convert the Cerner AR, lots of work to do there, and we can talk about that under R1, but I think that this is an achievable cash flow projection. So it's a nice little, I don't know, change as far as where we sat with things. So I'll entertain questions or anything about what we've presented here. And Brian has the file here. I don't know if we need to print this one page. I don't want just the file to go out, but if we can print this one page and get it added to the board packet and get it to all the board members, that'd be great.
Any questions for Steve?
Steve, it's Ken, just wondering, you said it looks like the days cash on hand is significantly improving. I'm wondering what our target is. Do we have a target?
Well, my target's 100, but the target we really need to hit is 80. That's our USDA number. That's our Western Alliance number. That's what they want to see. Those two entities want to see us with 80 days cash on hand.
Thank you.
And we'll be there in May.
Under this projection, yes. And one thing to keep in mind again is that that $1.4 million that gets us to our $8 million equity contribution, the way that Western Alliance has structured our terms is that we're going to be able to use that money on an ongoing basis. So as we make interim interest payments or whatever however the debt repayment works during the interim period, we're going to have that money available to us as opposed to that being frozen or whatever. So, I mean, it all comes out in the same number, but it just provides us a little more flexibility that we have that money there and we have it available to use. And so we know, hey, man, we're already 1.4 million towards our debt service in the interim, and that's huge. So yeah. And I've been conservative with revenue growth and with 3 full-time providers, a walk-in, and Dr. Ware seeing her panel of patients. You know, that's 4.5 providers. That's solid. That's solid staffing. So Heather Smith of note, when I was doing the statistics, she saw 300 patients in a month. You know, I don't know the last time we saw somebody have 300 patients. It's been a while. So that's great news.
Okay, any other questions for Steve? Hearing none. Thank you so much, Steve.
Thank you, Steve.
You always make
That's-
everything halfway make sense.
I'm glad I make it sense, and I'm glad when it makes sense, there's actually some decent numbers in there, right?
Right. That's the best thing for all. Okay, let's move on to item number 12, which is the.
Sorry, Sherry, for a second. I'll make a motion to accept the financial report from Steve for January.
Okay, do I hear a second?
I second.
Okay. Ken,
Aye.
Sally? Aye. Jerry?
Aye.
I always laugh when somebody's been the one that made the motion and then you ask them to. And I'm, always wonder if somebody would say, oh, no, I'm gonna vote no. Okay.
First time for everything.
We're moving on to item 12, medical staff report, which is a request for the board to approve Dr. Nielsen's recommendations submitted from the medical staff appointments, and I think we have that page in our book. Is there any objection? Hearing none, do I hear a motion to accept?
I'll make a motion to accept the appointments approved at the med staff meeting on March 12th.
Is there a second?
I motion to accept.
Okay, thank you, Shelley. Jerry,
Aye.
Shelley,
Aye.
Ken,
Right?
and I'm aye. So that's okay. Okay. Item 13 is the new critical access hospital skilled nursing facility board update, which is a general update report from Donna. So Donna, you can take it away.
Okay, I don't really have any updates from this report. If I can pose it as if there are any questions to what's on here.
Anybody have any questions? Have you had a chance to go through the report?
I think we're kind of in a holding pattern at the moment.
Okay. I think what we'll do is then we will accept the report as submitted. Do I have a motion to that effect?
We don't have to vote on this one, Sherry. Sorry
Okay.
to interrupt.
Okay, now let's see where we are. We're gonna, item 14, I understand we're going to table that because we have not received the information from the vendor for the medical equipment purchase order from Phillips Equipment, so.
That is
That'll be on our next agenda.
correct.
And then item 15, which takes us down to approval of the Seneca Healthcare Foundation board members. Possible discussion and possible action, and that would be Sean McKenzie and Steve Bowline, Chelsea Outland, and Tracy Smith and Tracy Holt. Two excellent people to add to our fundraising group. So,
So as this works, you're the general member. We can appoint, but you have approval as the general member. Everything needs to run through you. So we are putting our appointed board members in front of you. And if you choose to accept, then you'll approve them. And then we'll move to our foundation board and start doing the business of the board.
okay, do I hear a motion to accept these members?
I'll make the motion to accept the members. My page is cut off, so
Uh-oh.
the name.
We do that on purpose. Kenzie.
Members Sean McKenzie, Chelsea Outland, Tracy Smith, Tracy Holt, and Steve Bowline.
I'll second.
Okay, Ken? You can vote on your motion.
Oh, aye.
Shelley, Jerry,
Aye.
and I'll vote aye, so that gives you your start to go forth
Go forth and
and do whatever. So now I'm gonna go to,
Is it, a question, is that the limit of
No.
for board members?
no, the bylaws state minimum of 5 and up to 9.
Thank
But
you.
the bylaws are not yet adopted, so we can actually alter that before we go to our board.
okay, so item 16 is board committee reports. And I'm going to kind of ask as temporary acting chair that we put this aside until our next meeting in the interest of time, because we have a member who has a pressing obligation to leave. So item 17 is future board meeting agenda topics, which is, of course, the new hospital build and interim financing, new hospital build, the Citizens Bond Oversight Committee. Number 3 is updated cash flow analysis, finance, investment policy, Seneca Healthcare Foundation, and Plumas Lapco, and BKF grant prospecting, and physician contract negotiations, execution termination, and administration authority of the CEO, and any others. So any other topics you guys can't wait to discuss at the next meeting? Hearing none, that's good. So our next meeting, and I'll ask again, since we have some public members who sat through this whole thing, if you have any comments or questions or anything you'd like to add as a public comment, Steve, no? Tom, no?
Not at this time.
Oh, okay,
That's
well,
the most important stuff.
This is then item 18, which is our next regular board meeting will be scheduled for April 25th at 3 o'clock here in the conference room. And hearing no objections, the meeting's adjourned.
Thank you. And thank you for chairing, Sherry.
Thank you, Jerry. Have a Mai Tai for me.
Mhm.
Yeah, thank you.